Welcome to Facebook Live with Prairie Rehab this afternoon. I'm Jeff Steinberger, physical therapist.
And Megan Johnson, physical therapist assistant.
Today we're going to talk about some exercise mistakes that we have seen and noticed in people who are working their core. But first, remember to like us on Facebook, love us on Instagram and all the other social media things,
Subscribe to our YouTube channel,
which is Prairie Rehab / physical therapy. And we have several of these previous ones on there and additional education materials as well. So Megan, the core.
the core.
How many muscles make up the core?
A lot of them. 29.
29, yes, 29 muscles. And a lot of people think that they can isolate the core, and we have found that that is a little bit tough to do, so sometimes you have to be aware of what you're doing and move in patterns that bring the whole core working together.
Correct.
One of the things that we often see are people that have some problems with,
Forward flex posture.
yes, and what does that result in?
Well, when we're in a forward flex posture, our entire spine is out of alignment. There's 3 natural curves to the spine. We have our spine hanging up over here. We have a curve that we call lordosis, which is this angle, and then kyphosis, which Jeff is demonstrating.
I feel like Man in White.
And then you look like you should know. And then we also have a lordosis in our neck area. And to maintain those 3 natural curves for optimal posture, as well as just basic movement and decreasing things like pain, it's important to maintain those curves.
So the curves work as shock absorption, especially important in the low back, because we do see some people that think that they need to strengthen their core because they have low back pain. And they come in like that.
Correct.
Yeah.
Which is not good for our nerves, our discs in the spine. The pelvis is not properly aligned, which leads to muscle dysfunction in the glutes and legs, and we have a problem all the way down the chain.
And in addition to that, it's going to monkey with the different joints of the spine and
the hips,
which will also cause problems moving up as well as down. So
right.
We're looking for balance in your spine with a kind of a gentle S curve.
When we're looking at posture and how to maintain posture as well, a lot of times people will overcompensate and try to do too much to maintain posture, and then we are not in correct alignment, even if it feels like you're up straight. Something good to go by is that your head is over your shoulders, so chin tuck back, ears over your shoulders, and the top of your shoulders are directly over your hips.
And if you continue that line on down, then that line would go just right behind your kneecap into the front of your ankle. Behind the kneecap.
The ankle.
And through the ankle bone. So, and that sets up a nice stable platform for your core. What happens if you're wearing your Crocs when you exercise?
We're going to go into a shoe spiel right now. We do not recommend wearing flip-flops, Crocs, those type of unsupportive shoes.
Like open-toed shoes like Morgan has on with no support.
They're cute though. But don't exercise in them. Our posture and technique when doing exercises starts from the bottom up. So if we don't have a good support system coming from our foot, you're going to tend to roll your ankles and your feet in. You probably can't see Jeff's feet on camera, can you? Okay. the foot is going to roll in, which in turn is putting strain on the knees, hips, low back, and again, all the way up the chain. So it's really, really important to be supported with your shoe wear from the ground up when doing exercises.
Good. Anything else about the postural alignment that is on your copious quantity of notes?
I mean, in general, just a couple of notes that I have that I'm sure people are aware of, but just as a reminder, the risks of poor posture and prolonged poor posture are misalignment of the entire musculoskeletal system. So like we were talking about, all of our muscles all the way down. Wear and tear on the spine, which Jeff had mentioned with our spine there. If you don't have those three natural curves, we're putting pressure and rubbing things that aren't supposed to, like a vertebra against another vertebra. And that's going to make you more prone to injury and to pain. You're going to have decreased flexibility, really affects your joint health, lots of wear and tear on your joints, and affects your balance a lot too, which puts you at a higher fall risk, especially in the geriatric population.
And if you're not in the geriatric population and you're out of balance, that creates additional strains, as Megan talked about. So as an athlete, you run the risk of ACL tears if you are worried about your knees, or if you're a person who uses your shoulders, like throwing a baseball or a football, again, more shoulder injuries.
Rotator cuff injuries.
And if you're not an athlete, you're still going to run risk of hurting those joints in maybe your daily work.
Right.
So
another really big key to posture is your breathing. And we don't, as a general population, focus enough on your breathing. It's just something that you automatically do. But if you come into this forward posture and try to take a nice deep breath through your diaphragm, it's very difficult to do. And that results in using other muscles in the neck and shoulders to breathe, which is going to, in turn, cause pain and compensation patterns. So,
and frequent headaches.
yeah, and that's a big diagnosis that we see, or a big complaint that we see from patients that come in, is the headaches having to do with overuse of these muscles.
Good. So when I was talking to my group of compatriots this morning at our faith-sharing Bible study, they were excited to hear that I was going to be talking about mistakes of exercises, but the first one that they said is not exercising at all. So how much exercise do we need to do to make things effective and to change how our body reacts and adapts and benefits?
You know, I've read a lot of numbers and research out there. A good number to go by is 10 to 20 minutes per day of exercise you can tolerate. And you know, in one of the studies I read, we're not talking about out of breath, can barely walk to your car type exercise, just general exercise to improve your mobility and get your circulation going. So 10 to 20 minutes per day.
And we can do that by just parking your car or your bicycle, if you're bicycling to pick up your groceries, to park your car a little farther away and then walk in instead of parking real close. So
it's just those simple things you can do throughout the day to get yourself moving just a little bit more that really adds up. It's studies have shown it to improve blood pressure, to decrease your risk of type 2 diabetes. So there's a lot of benefits. The list goes on and on of just doing those 10 to 20 minutes of tolerable exercise a day.
And sometime if you'd like to listen to Megan talk about 45 minutes of that, we can arrange that, but Morgan says that we have to keep moving here. Oh, she just gave me the sign. She said, keep moving. So when we're talking about the core, one of the common core mistakes, Megan, that I see is people don't know what the core is, and we talk about 29 muscles, and I'm not sure that I can list all 29 of those muscles specifically.
Me neither.
However, I do know that traditionally people think of the core as, in my case, the fluff over the six-pack, but they think of these guys as the core, and
Which is a big misconception.
that there's fluff over that.
That too.
Yeah,
But
and they think of these guys, but that isn't all that's in the core. You talk about the diaphragm. What's the bottom of the core?
the bottom of the core is our pelvic floor muscles, which are the muscles that lay, well, we say like a boat within the pelvis. And that connects into the abdominal muscles that run along the front side of the spine,
So they're going to connect into here.
which stabilizes the spine from the inside. These muscles on the outside, when people are looking for a six-pack, are not good stabilizers or internal stabilizers of the spine to keep that core strong and stabilized when you're moving.
And those muscles also tie into your hips. Your hip rotators are part of your pelvic floor, so working your hips is a great way of working your pelvic floor and doing hip rotation exercises, which can be as simple as rotating your body as you're doing some exercises, because that involves the rotators. We don't often see that in people that come in and say that they need to work their core. Right?
Right.
All right. What are some other things? So far we've gone through 4 of the 5 things that we talked about. So one is a good foundation. One is making sure you're doing the exercises. One is including all of the exercises in muscle groups. One of them is staying in some alignment as you work on it. And we promised 5. Which are the other list that you want to take of your favorites?
I'm gonna say consistency.
I like that.
Consistency is a key factor in maintaining good posture, prolonged good posture. And we're not talking next month or next year. This is the only spine you get. And protecting it and keeping up with an exercise program that fits with your schedule but keeps you active that 10 to 20 minutes a day. And doing that consistently is going to keep your body healthier and keep you feeling better for years to come.
So next week we're going to talk about some additional exercise things that we have discovered over in my case, a lot of years, and Megan's a lot less years, but we're going to talk about some exercise things that might help you to be more effective in working your arms and your legs and your shoulders and your more specific instead of the core. But again, we want to remember that when we start with the core and we have it working, that a lot of other movements really, really are going to be much more correct and much more natural.
And beneficial.
And beneficial. Thank you for listening to us today. Again, if you want to send us your comments, if you want other ideas for exercises, you can email us www.prairierehab.com. There's links on there. You can leave comments on Facebook, and Morgan or one of us will get back to you. And again, subscribe to YouTube. Prairie Rehab Physical Therapy to see past programs that we've done, including lots of different exercises specifically for some of the things that Megan and I talked about. So thank you for being a part of our day.
Thank you very much.